Hello and welcome to webinar series from Happiest Health. Happiest Health is a health and wellness knowledge enterprise which will bring you a series of webinars on various health topics. I am Kumaran and I will be your host for today's session on sleeping habits. Learn the trick. Sleep plays an important role in a person's health and well-being. More so, recently in June 2022, the American Heart Association added sleep to their checklist of heart health. This means the researchers over the decade have worked on the effects of sleeping well or not and how it is affecting the bodily functions. Not just that, several research papers, experts, sleep communities have been advocating about the sleep hygiene and how one needs to sleep and for how many hours, an ideal number of hours of sleep required per person. Despite which, there are several sleep disorders which has troubled many in various age groups across the world. To delve deep into all of these aspects of sleep, we have with us a robust set of panel members who will be sharing various facets of sleep and its related subjects. Firstly, let me introduce our panel members. We have with us Dr. Satyanarayana Mysore, Head of the Department and Consultant Pulmonology, Sleep Medicine, Lung Transplant Physician at Manipal Hospitals, India. He has over 2 decades of vast experience in the field of pulmonology, respiratory medicine in India and Australia, and has treated diseases like asthma, COPD, rare lung diseases, to name a few. In the field of sleep medicine, he has expertise in obstructive sleep apnea, insomnia, circadian sleep rhythm disorders, jet lags, dream disorders, restless lung syndrome, to name a few. In his interventional pulmonology, he had several procedures like the image guided transbronchial lung biopsy, linear endobronchial ultrasound, and many more. Dr. Mysore was part of the state team of COVID-19 experts in the country and introduced telemedicine for helping the people during the pandemic. We welcome you, Dr. Satya.
Thank you.
Next up, we have with us Dr. Vivek Anand Paregal. He's the Director of Pulmonary and Sleep Medicine at Fortis Hospital, India, and he's a diplomat in Sleep Medicine, American Board of Sleep Medicine. He has clinical experience of more than 20 years in providing comprehensive pulmonary services. He had practiced in the United States of America prior to returning to India. He was faculty at the Baylor College of Medicine, Houston, Texas, USA. He served as Chief Medical Staff, Dallas Medical Center, USA, and Vice President of Staff, Regency Hospital of North Dallas, USA. He is a Fellow of American College of Chest Physician, FCCP. We welcome you, Dr. Vivek. Next up, we have with us Mr. Matthew Hosnell, works as a community director for Trend Community, a rare disorder social listening company. He's a father of 3 and a person living with type 1 narcolepsy with catalepsy, since age 12 and diagnosed at the age of 25. He's a volunteer, webinar presenter, and a featured speaker for 4 patient advocacy organizations: Project Sleep, Wake Up Narcolepsy, Narcolepsy Network, and Faces of Narcolepsy. He also serves as a patient advisor for 2 pharmaceutical companies and 1 biotech startup. An outspoken advocate on social media, he is known for the longest hashtag in the sleep community, world's strongest person having narcolepsy with catalepsy. We welcome you, Mr. Matt, and thank you for joining us from the US.
Thank you, sir.
Let us move on to the discussion, and I start with Dr. Satya. Dr. Satya, firstly, the recent development by the American Heart Association recommending or including sleep as a checklist point for cardiac health. How do you see this coming, and how important is sleep for anyone?
Thank you, Mr. Kumaran, for getting me to be on this panel so that I can share a few information. Now, this particular thing was long overdue. Sleep and body restorative functions are intertwined and interlinked. About 8 to 10 years ago, what started off as a project in Australia, where I was involved, is to look at people who undergo cardiac ablation. That is, you burn out the tracts that cause funny rhythms in the heart, And these people, some of the portion of patients redeveloped the burnt tract, and the vast section of these people who had a rejuvenated tract were those who had sleep apnea actually. So therefore, sleep disorders do affect body functions in what we know is a known pathway, but number of other interactive mechanisms, and the impact is quite distressing, I would say. For example, since the time sleep medicine, sleep as a medical aspect was being practiced, it was a common knowledge that people with cardiac failure,
Okay.
that their pumping action is compromised, these people would tend to sleep poorly. That is
Okay.
putting it in very simple words. But then they kind of develop a very complex sleep disordered breathing. Because of
Okay.
the less pumping action, the body is very, very hungry for good output and good pumping action from the heart. So the brain catches on to that particular message. So you have a discrepancy on what the heart can do and what the brain expects.
Hmm.
So the breathing is totally not on an autopilot. When during night, it should be on autopilot, and minimal energy is endured in keeping the acts of breathing, circulation, and other things.
Okay.
That is when the body would get rest.
Hmm.
So the science was always there. The data points are coming out now, and I would say that is welcome, because we could be talking to a lot more people confidently based on the medical evidence, and
Okay.
say that, look, why do you need to address your sleep issues is because you want to prevent a cardiac event.
Hmm.
Thank you.
Right, right. Doctor, when you explained about how the cardiac health and the sleep have actually been a long due, and it has got a due today, I would like to ask Dr. Vivek, Doctor, in your career spanning decades practicing sleep medicine, what, according to you, are the basics of sleep that are missing currently? And also, how does one understand the importance of sleep in anyone's life?
Those are very, very big questions with
Yeah,
maybe not very clear answers,
yeah,
but I'll try and break it down. Okay.
sure.
So, what is sleep itself is kind of a nebulous question because we really don't know what is sleep.
Right.
We do know that it's an altered state of consciousness. We do know that a lot of the functions shut down and your brain behaves differently. But exactly what happens besides a few points, we really don't know. We know
Okay.
that memories are consolidated. We kind of give our brains a bit of a reboot. And if you don't sleep, it has dire health consequences.
Right.
So if you don't sleep, it can cause a lot of issues. So when we look at sleep, I think you can look at it in different types of ways. You can look at it in a qualitative type of way that are you getting good sleep when you get sleep, or is it poor sleeps? You can look at it quantitatively. How much sleep are you getting?
Right.
Is it adequate? I think just looking at different aspects will give you some insight of whether you're getting good sleep.
Right.
I think bottom line is if you can sleep the whole night, get up, feel refreshed, and function correctly during the day, that is good sleep.
Okay.
So, good sleep is because you're sleeping well and the restorative functions are there.
Right, right. Okay. We'll touch upon the points on how much sleep is required and everything during the discussion. I would like to come to Mr. Matt. You have seen issues with sleep from the age of 12, and at the age of 25, that is in the year of 2007, you were diagnosed with narcolepsy. Tell us about how narcolepsy started. What were the initial symptoms, and how did you land at this condition?
So again, thank you. It's an honor to be here. So as you were saying, my symptom onset what was about age 12, plus or minus a few years. That 12 is when I can really point to the fact that it started to be very disruptive to
Mm.
to my life, and that was when I'd wake up in the morning. even before right after breakfast, I would actually take a nap on the couch as my mom would be driving me to school. I'd be take another follow up 10 or 15-minute nap on the way in. And then throughout the day, I would take, 1 or 2 naps at class. Well, when I got home, I kept that to myself. I didn't open up a lot about it. This was my normal. I would see other kids sleeping in class, but what I didn't realize is that they were going to bed at, 1 or 2 in the morning. I was going to bed at like 8:30 at night. So I really wasn't aware that this excessive daytime sleepiness was that profoundly different than others. That's really the hallmark symptom of narcolepsy. It's one that everybody with the condition has, and along with there's hypnagogic and hypnopompic hallucinations, which is an overlap of dream on reality. So when you're going into sleep and then when you're coming out of sleep, so you may see something, you can hear things, you actually can have a tactile sensation of your chest being pushed down and compressed. Many times that's associated with sleep paralysis. So you again, that's a disruption of that sleep wake moment. So I'm paralyzed when I wake up. I can hear everything around me. And it can be very terrifying if you don't know what it is. Even, here I am 25 years later, and when it happens, it still gives me a bit of a spook, trying to come to in the disrupted fashion. I have the variation called narcolepsy with cataplexy, or type 1. And that involves an involuntary loss of muscle tone related to emotional response. It can be partial or full. So I've had a couple of episodes involved with fear when I collapsed fully. I've injured myself on a couple of occasions, broke my leg once. I fell off a moving truck and broke my rib. But the more frequent variation for me is like a slurred speech. My knees will get very weak. I will drop things with my hands. I'll have a very flat affect. My jaw will drop and my head will start to drop, particularly when I'm more tired and emotions are on the surface. And all of that is from that disrupted nighttime sleep. Dr. Vivek did a great job of explaining how important sleep is and how sleep disruption can impact life. And that's really kind of where I sit. I sit in a place where my sleep quality is so disrupted, and that being the final symptom of narcolepsy, that it impacts my daily function. As far as how I got here, scientists aren't entirely sure, but most agree that it's based on a trauma that triggers an autoimmune response. So my brain in type 1 narcolepsy doesn't produce hypocretin. So for me, I can point back after conversations with my doctor and say that it was a strep virus that I had that caused this hypocretin or orexin cell, depending on who you're talking to. It's the same thing, but was ultimately wiped out to the point where it reads very low on a spinal tap. So that's how I got here. It's an involved process, but that's ultimately kind of what led me to living with narcolepsy and how it impacted my life.
Right. I'll come back to you, Matt, about the entire struggles, entire challenges that you face and the number of hours that you face. So something that very strikingly comes to mind when we talk about the number of hours. So I'll ask Dr. Vivek. Dr. Vivek, it is said that the parents' working hours affect the entire family's sleep, especially the youngsters do not sleep well because of this. How do you associate one sleeping patterns affecting the others? You're on mute, doctor. Yeah.
Sorry. It does certainly affect things. One person's sleep pattern does affect the others, and then multiple layers to this. We'll start off with how much sleep does a person need.
Right.
In general, most people need 7 to 9 hours of sleep. Now, children, especially in the growing phases, need a lot more than that. And what is happening, particularly in India, is that people are working longer hours, longer commutes, they're getting home later, and they're working night shifts, day shifts. So the amount of hours spent awake with the adults is a lot more. So many times what happens is parents come home late, the kids stay up with them, and they don't go to bed. And this is a very common issue. What is really important here is that kids need sleep. It's not just for cognitive uh, recovery, it is for cognitive growth, it's for physical growth. Um, so all of these things are very essential for a kid to grow. So if the kid isn't getting its 10 hours or 12 hours of sleep, there are going to be severe physiological consequences potentially. So the children trying to follow the parent schedule will not work. So that's very important, that children get more sleep. And there's plenty of evidence to support what I'm saying. The other thing is, for example, if one spouse snores loudly, the other spouse has disturbed sleep. And there are actual health consequences for the spouse who's sleeping next to the snorer. There's increased evidence of hypertension, there's increase of decreased functionality during the day. So it's not just the person having the sleep disorder having the issue, it is the person who's sharing the bed with that person. So definitely what happens in one's sleep is not completely isolated from the rest in the family.
Right, right. So, what are your tips to the older people, doctor, when you say this?
Now, there is a little bit of controversy about this, but as you get older, you tend to sleep less. Now, if you go by the official things out there, no, you don't sleep less. But most older people have a decreased level of sleep in the terms of the quality of sleep. And that can be because of aches and pains. It could be because of things like restless legs, kicking your legs at night. As you get older, we have more sleep apnea, and we'll be talking probably a little bit about that later, snoring and so forth. So this decreases the quality of sleep. So this maybe allows them to get up a little earlier than they would. But bottom line is, if you are functioning well during the day and you're not sleepy and you're not falling asleep during the day and you're getting your 6 to 7 hours of sleep, even as an older person, it probably is enough. Somebody who's getting 6 hours of sleep but is functioning and not having issues, that should be enough. Now, a lot of older people also take naps during the day.
Right.
So you have to add that on to the total sleep time. So a lot of people will come and say, I can't sleep, but then they take a 2-hour nap in the afternoon. So you're going to have to take it together. You want to look at the total quantitative time of how much sleep they're getting when you're calculating it. Again, taking a nap is not necessarily a bad thing. There's a lot of restorative features of taking a nap. In fact, a lot of data in narcolepsy, right? And taking a nap actually can be very regenerative. So the siesta of Spain is probably a good idea many times. So like I said in the beginning, it's not just the quantity, it's the quality of sleep. So if you can get the total amount of hours you need to function, you'll be okay.
Right, right. On the same lines, Dr. Satya, you have always advocated that not everyone needs to sleep for 8 to 9 hours. It varies from persons.
Absolutely.
What do you have to tell about this ideal sleeping hours?
Absolutely.
Yeah.
The simple things are, look at a newborn kid. Yeah. It would sleep for 20 hours, may wake up for sleep or a nappy change.
Right.
And as we grow older and older, from the 6th decade onwards, the slow wave sleep or the deep sleep or stage 3 sleep disappears. Why does it disappear? The nature has devised this particular phase of sleep, which can be 5 to 15% of the total sleep time for body growth. So you grow till your maturity years. So in the younger people, adults, adolescents, the slow wave sleep is very much required because during that time growth hormone is released.
Okay.
Now the agreed principle is a 70-year-old elderly person may not need growth hormone. Therefore, that phase of the sleep is taken out. The second sleep phase that gets slightly phased out in the duration is the REM sleep. REM sleep gets little shorter as we age. So there is total physiological loss or consolidation of sleep as we grow older. That apart from this, the established truth is that everybody's sleep architecture is different.
Exactly.
You would find that either Matt or Vivek can function brilliantly for 18 hours a day and can very well do with 4 hours of sleep on a particular night. That is because they may have the sleep architecture which is wonderful. There is perfect balance between orexin, hypocretin. Their peripheral nerves are excellent condition. They don't send out unnecessary signals to the brain, keeping the brain woken up. So, whereas I may require 9 hours of struggle to sleep, at least to function for the next 8 hours before I feel sleepy again.
Yes.
So, look at the sleep from more of a qualitative type.
Right.
Quantity is always secondary. Look from a very individualized or custom derived sleep quality, and also take always the age into consideration.
Okay.
And the daytime nap, as was alluded by Dr. Vivek, that should be actually the focus. So I think this is my side of the story.
Right. Dr. Vivek and Dr. Satya, both of you have actually told that the quality of sleep is something that we need to talk about. When it comes to Matt, of course, when I'm talking about the quality, I don't know how much you can relate to it. You must have had terrible nights without sleep. And your sleeping hours have drastically changed over time, probably. When did you get to know that you were having issues with the time you sleep, and generally, even today? How many hours do you get to sleep?
So that's a great question, and I just want to applaud both the doctors on the panel for talking about naps. It's something that for me is essential to making sure I get my total sleep time in and to navigate through those periods of the day when profound sleepiness hits. So when I started to when I look back, that I struggled to have consolidated sleep at night, even from a very young age. My teenage years were wrought with frequent nighttime awakenings. I'd pop out of bed, not sure why, go back to sleep. I assume that was normal for everybody. It was when I look back, it was after college, right when I had become a father, that I realized that I couldn't meet the demands of life with the sleep that I was getting. I would get during the nights before work 8 or 9 hours minimum. On the weekends, I was sleeping 12 to 14. My sleep duration was all over the place, and it was an attempt to try to catch up. And really, it's hard to view sleep as a bank. You don't just make a deposit, pull it out when you need it. It doesn't really work like that. So I started to realize that I was having trouble. I would wake up and go to work. I was finding myself actually like pretty much in a sleep state, a micro sleep in a closet, not quite sure how I got there. It was really confusing time, particularly because if I looked at the literature that was out there, and I studied quite a bit on exercise science, sleep was a very important part of health during my college years. I was getting the right time of sleep, but again, my sleep quality was so bad there was no way that I was meeting with the demand. So ultimately, that led me to schedule an appointment with a sleep doctor. I had a journey of misdiagnosis for depression because the doctors would recommend trying an antidepressant that would actually mask part of the narcolepsy symptoms. And it reduced the cataplexy. They added a stimulant, thinking I had attention deficit disorder, and so it it all kind of led up to the point where I just couldn't function, and so that's when I went and sought an answer. Um, and my sleep time has changed now that I'm on medication. I try to keep my sleep architecture a little more consistent. Well, I can't really keep the architecture consistent, but I can keep the time that I'm waking up. That rise time is the essential time for me. And as was alluded to earlier, I can make up that total sleep time in naps throughout the day. So let's say, like, I woke up a little bit early today. I'm gonna be able to take a nap, probably a 2 nap, maybe even a 3 nap day by adding in a couple 15-minute naps towards the end of the day to get the total sleep time I need. I sit right at about 8.5 to 9.5 hours to make up for the poor sleep quality. Sometimes it can get up to 10 hours, but for me, the most important component is that consistent rise time. So, if I struggle to get to sleep at night, or if I have a rough night, if I get up at that same time and then adjust with naps throughout the day, that helps me to function at my best.
Right. Thank you, Matt. Uh, I remember when you told me about how doctors misdiagnosed in the early stage and how antidepressant pills were given to you. Dr. Vivek, I would like to ask these two questions. What are the various sleep disorders you have treated, or in generally you've come across, and also what are the underlying causes of these disorders? And like Matt said, are pills the only way to treat the sleep disorders?
Oh, that's a very interesting question, and it probably has the contents of the entire textbook of medicine of sleep disorders. But
Okay.
I'll try and break it down for simplicity. Really speaking, you have conditions where you're not able to sleep or you're too sleepy. Those are the really roughly two big categories. And I think the more common one would be probably inability to fall asleep. Insomnia, just not able to relax. And many times people throw pills at this. But this is more of a behavioral problem, which maybe has biological basis. What I'm trying to say is we have a lot of bad habits going to sleep. Now, especially if you're having problems falling asleep, you have to follow something called sleep hygiene. And Matt kind of alluded to this just now. You have to try and keep the same sleeping time and waking time. If you're having problems falling asleep or you're too sleepy, try to give yourself some structure. The whole ritual of trying to fall asleep is actually a ritual. And I don't know whether people notice it consciously, but you go through a certain set of actions when you're trying to fall asleep. And so we're doing a lot of things today which disrupt that. For example, we're looking at our devices, we're looking at our phones, we're looking at our iPads. That has a lot of blue light, which is stimulating. We might be going to the gym at the end of your day of work and going to bed within 2 hours or 3 hours of exercise. So what is that doing? It's stimulating you and preventing you sleep. We might be doing a lot of different things, and we probably don't have time to describe all of that, but regulating those behaviors and doing things properly before you sleep really goes a long way to treating insomnia. So that's a discussion for another day. There are things called restless leg syndrome, which again causes you to not fall asleep because your legs start moving. Okay. Some degree of exercise can help, but many times people do need pills for that. Okay. Now, the conditions which cause increased sleepiness, such as sleep apnea, which is probably the most common diagnosis, where people snore, and the snoring and the throat closing off while they're snoring causes disruption of sleep and causes them to wake up every few minutes for a few seconds. So the sleep is non-restorative. They get up sleepy, they're tired. So that is typically treated with a machine called CPAP, continuous positive airway pressure. And wearing a machine like that does help somewhat. Sometimes people need something like a mandibular device where they put it in the mouth to create more space in their throat, or they may need surgery as well. There's another condition called periodic limb movement disorder, where people move their legs at night, which disrupts their sleep. And treating that or treating certain deficiencies associated with that can help. Unfortunately, another pill. And then
Okay.
the more rare stuff like narcolepsy,
Yes.
which is probably there more than we know it's there, but we're not diagnosing it. Again, has to be very holistically treated. It's not just the pill, or rather, and in some cases, liquid now. And so you have to make sure that you have enough sleep. Now, in general, the rule of thumb is if you have a sleep disorder and you're not getting enough sleep, you're going to make it worse. So
Okay.
if you don't get 8 hours of sleep and you have one of these conditions, almost everything gets worse.
Okay.
So you need to get those hours of sleep. You need to be able to have some discipline in this set. Okay, there are other rarer disorders like hypersomnia, which is like narcolepsy, but you're just sleepy. And that can happen after head trauma and things like that. That is typically treated again holistically with medications. And rarer stuff are things like you start acting out your dreams, some stuff called parasomnias or REM behavior disorders, where you actually start behaving physically what you're dreaming in your REM sleep.
Okay.
Again, many times there are pills for this, but like I said, the key thing is sleep hygiene,
Okay.
which is basically doing your sleep right. Okay, treating the underlying issues if there are any, and then the lifestyle changes which go along with it. Like I
Right.
said,
Right.
it's a very big topic. I tried to boil it down.
Definitely. That indeed was a very knowledgeable information, Doctor. But I really want to ask all three of you. There's this one question when you talk about sleep hygiene, and when doctors talk about how do you need to cut down on the blue lights and everything. But one thing that sticks on to all of us: exposure to phone during bedtime, an issue that does not seem to settle down with youngsters, Doctor. How do someone come out of it? Like, what do we have to do? It's a question to all three of you.
Yeah.
Yeah,
So when we talk about what
yeah,
happens if you look at a tablet or an
yeah,
iPhone or whatever it is?
yeah.
The phones will emit light in the wavelength of 400 nanometers. Now
Okay,
that is going to stimulate your pineal gland,
right,
and that will postpone the sleep, not just the time of sleep,
right,
the phase of sleep itself is postponed.
right.
So one of the bigger share, the bane of modernization or industrialization or
Technology,
technology
yes,
is that we are living in times where the circadian sleep rhythm is getting dwindled out.
right,
So that is a big share of thing, whether it is jet lag, factory workers, shift workers.
right.
Basically, the phones are forcing us to get into a mode of jet lag.
Yeah, yeah,
So the effects are profound. So if you look at how ingenious our scientific times are, most of the phones are coming out with a click of a button. You can switch on the blue light filter,
yes, yes.
but that doesn't do anything,
Okay,
because you can't filter out the 400 nanometer wavelength.
right.
You can cut down. So I think in the previous question you were asking, how do we treat, is most often everything depend upon pill?
Hmm.
No, I think we need to individualize. We need to look at the patient or the person in front of us, find out what is the problem, and if it is essentially boiling down to very good sleep hygiene is what is the requirement, need of the hour, we need
Yes,
to
yes.
address that after counseling the individual quite well about the implications of not maintaining a sleep hygiene versus simple thing like maintaining sleep hygiene.
Sleep hygiene. Correct,
Yes.
correct, correct. Doctor, when we talk about this, sleep, as you said, sleep affects a person to think clearly, make sensible judgments, and so on. How does sleep play a role in mental health? of a person. If we look at Mr. Matt, one of our panelists, he's a father of three and still with narcolepsy. How does one handle it?
Yes. So in one of the Western countries that I practiced, I had this patient um, who used to be in the outbacks. And in the outbacks, there would be spells of narcolepsy despite having very good length and quality of sleep. There
Okay.
will be unwelcomed intrusions of sleep in the most inopportune time. And this person used to carry the haversack and get onto the top of a tree or somewhere, leave the car parked slightly far away, and it was very, very difficult for this particular patient of mine, because the family issues came to much more of a fore, and it was a kind of distress, lot of distress, because till the partner understood what was the medical issue, it was more like, oh, you're trying to avoid me,
Right.
or you're doing something and you're not getting the enough sleep that you should. Why don't you sleep it over?
Correct.
I think most often, why does sleep disorder in one person affect the other is because the knowledge about sleep disorders, good sleep, is never understood nor understood, and therefore meetings like this, initiatives like this are important in
Exactly.
taking down to the masses some
Right.
of the myth busting myths that can be busted, and share the knowledge. So I
Absolutely.
think when you want to treat somebody with sleep disorder, whether it is sleep disordered breathing, of which you can get central sleep apnea, obstructive sleep apnea, or complex sleep disorder, whether it is circadian sleep disorder or genetic or inborn errors of sleep, like brain fluid as normal orexin and hypocretin, which is type 2 of narcolepsy. Narcolepsy itself has so much of sub varieties there,
Correct.
with cataplexy, without cataplexy, and so many other issues. Movement associated sleep disorders, whether it is periodic limb or restless leg, number of things. You do not treat one single individual before you actually treat the family if you want your treatment to succeed. And forgetting the debate on whether it is everything depends upon pill, I would say you need to have a customized treatment,
Correct.
personalized medicine.
Right.
And then medicines play only a small part of it. It is
Right.
the approach to the person with the problem that matters.
Right. Right. Absolutely. Absolutely, Doctor. Thank you so much, Mr. Matt. When we talk about this diagnosis and everything, tell us about the struggle and urgency for reducing time to diagnose. How has it been for you psychologically?
Yeah. So great question. My time to diagnosis is about 13 years. The statistic we often quote in patient advocacy is, the time average is 8 to 15 years, and unfortunately that puts me there. I actually facilitate small groups for other people with
Right.
narcolepsy, so whether newly diagnosed or who've been living with the condition for decades. And you see it time and time again. People feel like they've missed out on life because they didn't have an answer. They didn't have treatments. And I want to applaud both doctors here for talking about treating both the whole person, understanding that there's behavioral approaches, whether it be through cognitive behavioral therapy, social support is a big aspect of living with narcolepsy, but helping to empower them with options for treatment, whether that be medications, promoting naps, the social support aspect, some lifestyle adjustments, making sure that you're helping them. They can only get that help if they actually know they have a condition. They can start looking for answers, but until they have that missing piece of a diagnosis, it's an incredibly heavy burden. There's feelings like you're not doing society had put so much emphasis on working harder. And quite frankly, when you're dealing with a sleep disorder like narcolepsy, that's not something I can just do. I can't work
Okay.
harder without having severe consequences in aspects of my family life. So my ability to interact and engage, I had to reprioritize what's most important to me. And so that's being a dad, that's being a partner, to my wife, making sure that they get some of the best of me as well. And I can only allocate so much throughout the day. So focusing on what's most important. And again, for me, I'm a big proponent of counseling, looking for answers through talk therapy, coming up with behavioral approaches to help me live a better life. But it's a very heavy burden. You feel like you're alone, you feel isolated. The sleepiness fuels all of those concerns, and exacerbates those emotions, heightens kind of the sensitivity. I jokingly call myself um, very cranky in the morning. It's not always a joke, but I have to remind my kids too. I have to come back and apologize.
Okay.
Daddy wasn't acting at his best. And so giving myself grace, giving other people grace, if they may say something that I take as cross, those are all important things. But again, if I don't have a diagnosis, I can't really look for the right answers, and I can't live my best life. And ultimately, that's one reason I share my story, is to help reduce that time to diagnosis.
That's really great, and how you've been able to combine the entire professional and the personal life, Mr. Man. I'll come to Dr. Vivek on one of my last questions that I wanted to ask. Doctor, I've read that you've spoken a lot about slow down and practicing wake rest to keep stress at bay throughout the day in one of your articles. Could you please elaborate on that? And also, there are people who feel that sleep is not enough the moment they get up and the whole day is gone for a toss. How do you explain this?
Okay, so it's a little ironic that a sleep specialist gets asked this question about wakefulness, but
Yes, yes.
it has come up several times, and I guess that's why I've ended up writing a few things about it
Yeah.
or commenting on it. So basically, it is a time where you consciously shut off. You're not doing anything. You're letting your mind wander. Okay. You're not doing anything structured.
Mhm,
And it seems to help with a lot of different processes.
mhm.
Where I got kind of interested is it seems to help with people with sleep disorders.
Okay.
So what you do during wake actually might help you with your sleep. So I think it helps with decreasing anxiety, consolidating memory. Many times when we're driving, many times we should be pay attention to the road, but our minds wander, and sometimes you get a creative solution. I think this has happened to many of us. When we're just sitting and we're not doing something, say you're sitting in the subway, or
Yeah.
you're in traffic and you're sitting in traffic, suddenly things will occur to you, solutions will occur to you. And that kind of is what wakeful resting is.
Okay.
Okay. So that moment, that spark that you have, the
Okay.
thought is you're not actively thinking about anything. You're not actively putting your mind towards something, which
Okay.
allows your mind to work in a different way. So, and that kind of is what it is. Now, if you're getting up, and for your second part of the question, if you're
Yeah.
getting up in the morning and you're not getting restful sleep, then there's something wrong.
Okay.
The hallmark of a good night's sleep is that you should feel rested. Now, most of the time, we're just not getting enough sleep. Our modern lifestyle prevents us from going to bed on time, doing a lot of things we talked about. Dr.
Right.
Satya talked about that also, that we're doing a lot of things with our lifestyle that are disrupting our sleep. So, number one is see what you can do as an individual using your common sense of trying to improve the quality of sleep. Most of the time, it's just adding another hour of sleep to your sleep.
Okay.
Or taking care of things like you don't want to have a lot of ambient light in your room,
Mhm.
because that can disrupt your sleep. That so-called night light could be disrupting your sleep. You want to make sure that the temperature of your room is adequate. Use your air conditioner in the summer. Make sure that is a comfortable temperature. Those sort of things are very important. Now, if you're still not feeling refreshed at the end of it and you're getting enough sleep, then maybe you need to seek help at that point.
Right.
It's a very good indicator that your body's telling you something.
Yes.
So if you're waking up in the morning and saying, I need to sleep more, then you're doing something wrong. And most of the time, you can fix it yourself.
Definitely. Thank you, doctor. I think we'll bring this as a separate session in the next session, because we need to talk about insomnia and everything. Dr. Satya, one last question that I would like to ask you. How does the whole process of sleep and pulmonary work hand in hand? Or are there vast differences on the functioning of the body?
Right. When the birth of sleep apnea, sleep medicine took place, it was mainly the psychiatrists and neurologists that were involved in coming out with concepts about sleep.
Yeah.
However, in the 80s, number of eminent pulmonologists, one of them is Doug McEnroy, a brilliant researcher who is now retired. They were all involved in sleep medicine. So why? And the simple thought process is, during daytime, the breathing is under our control, at least at times. But during sleep, all the functions, including breathing, is under an autopilot. And number of things started going wrong. We were snoring 40, 50 years ago was considered as a sign of health and prosperity. You are well fed, you are well to do, and you would snore away to glory. However, the perils of snoring and what it signifies, narrowing of the airway and apnea or stoppage of breathing, all this came through. That is when pulmonologists took over practicing sleep in a bigger way. Now, what we need to realize is, you cannot be very, very choosy about practicing a particular branch of sleep.
Okay.
You can't be saying, I'll treat only sleep apnea, because the chance is that you would miss a large spectrum of sleep disorders. For example, what we didn't discuss is one another entity, which is sleep misperception.
Okay.
People sleep and they feel they overslept, or they feel I never slept.
Yes.
Then the electroencephalogram actually shows that they slept much more than combining two people's worth of sleep. So it's all bothers down to counseling and things like that. So number of sleep disorders do exist, as Dr. Vivek and Matt told. There is a lot more to sleep medicine than what can be discussed in this short length of time.
True.
But hats off to you for scheduling us to come out with a minuscule bird's eye view on various aspects of sleep medicine.
I think this is the start, doctor. I think we are talking about sleep in webinar sessions.
Sure.
That itself is a start for us. One last thing before we wrap up, I would like to ask Mr. Matt an entire wrapping up session. What would you have to say to the global audience on sleep and its related issues, Mr. Matt? You've been a global patient advocate. What has been the best working model to sleep well?
Yeah, so the best model to sleep well is to follow the advice of your sleep physician. The consistent rise time has been essential for me, and that consistent sleep time. So not deviating more than 30 or 45 minutes. I've got kids. I understand things happen, and I have to make changes and adjustments. But maintaining consistency as best as possible. And in terms of if you get diagnosed with a sleep disorder, you may have to let go of some past dreams, but that doesn't mean you can't dream new dreams. Metaphorically speaking, find and set some goals that you can attain that are realistic. because you can live your best life with these sleep disorders, but you may not be able to continue to chase that same dream. If I were to try to go back and go to medical school, I wanted to be a physical therapist in college, that would probably be too heavy of a burden while I'm raising a family right now. So making sure I understand that, I can still be a success, even though if I have to define that slightly differently. And again, find that support that can help you. The groups that I lead, we welcome people from across the globe. So if you have a computer, you have Zoom access, we're happy to have you join us to talk. If you think you're living with a sleep disorder, narcolepsy, or a hypersomnia, come talk to us about it. We'd love to get your perspective. But that feeling of connection, being alone in a crowded room, is a very true statement when you have a sleep disorder, because you just feel like you're on an island. So
Mm.
so step off that island, and just ask for help.
Right.
And don't be afraid to incorporate some lifestyle adjustments. Talk to your physician about diet or exercise change. For me, physical activity plays a huge part in, again, living my best life. So
Okay. Thank you so much, Mr. Matt. Thank you, Dr. Satya, Dr. Vivek, to sharing us with this entire amount of information within a very short duration. Definitely, we'll be having a lot of series of sleep stories and sleep webinars, sleep videos for that matter, and one-to-one discussions in the future. Thank you so much, panelists, for joining us today. And
Thank you.
this is Kumaran signing off from Happiest Health. Thank you.